Really exciting recording in progress. We have a really exciting meeting, I think, today. Again, I'll say on the outset, thank you to the legislators who've made time to join us. And after the 2 o'clock hour, then there's time to come off mic and we'll invite you to speak up. And I will say we have wonderful leadership here who've supported the Bridge Coalition and specifically the Bridge Housing. So I really am grateful you're here. I'll ask you all to put your name, pronoun, and organization in the chat, please, so we can keep track of who joins us, so we can keep proving to the healthcare authority that we actually do have these meetings and folks actually come. A little bit of review. The mission of North Star Advocates is to prevent and end youth and young adult homelessness by strengthening families and communities and young people, and by holding the systems designed to support them accountable. And as many of you know, we have been working off of a report drafted back in 2018 that showed of all the young people who are homeless within 3 to 12 months of exiting a state system of care. And as you know, state system of care includes foster care, juvenile rehabilitation, and inpatient behavioral health. So of all the young people who exit those systems and become homeless within 3 to 12 months, almost 80% are coming out of inpatient treatment. And those on the front lines, that's not news to you. You see it every day. In fact, we talked to some outreach workers who said they don't even refer to inpatient anymore because young people come back and they thought it was an exit out of homelessness, and instead they get sent right back to drop-in centers, emergency shelters. It crushes the morale for their staff. And the word on the street is, why would a young person go to treatment if they're going to send me right back here? So that's what we're all about at this table here, is trying to change that data point. And for me, trying to change the narrative on the streets so that it's they view treatment as a way out. And there's this thing called Bridge Housing that helps you get set up. It's a safe landing out of inpatient, and then they help you identify long-term housing and your North Star. Forgive me, I have to sneak that in, of course. And again, we know with most of our data points, queer youth and brown and black youth are disproportionately represented in this data. So we're really excited. The purpose of the Bridge Coalition is, one, to share information and resources. Second, to develop the return to community planning, which we'll talk about a little bit today. We reject the term discharge planning. That often means an address. We want return to community planning, which it not only includes safe housing, like Bridge Housing, but also what are your passions? What therapy can we set up before you even get to the community? What relationships do you want to mend and heal? So it's just more of a holistic perspective that we think the Bridge Housing is going to help bring alive for young people. And then the third is, what's the advocacy agenda? What are the recommendations to healthcare authority, legislators, the governor's office about what policies, practices, and budget investments would be helpful to preventing and ending youth and young adult homelessness, and having behavioral health be, again, an off-ramp from homelessness and an on-ramp back to the table of community. So I'm really excited. Today, what we plan on doing is, we really want to give you an update from Friends of Youth and Excelsior Wellness. You may recall 2 years ago, thank you to the legislators here, we had bipartisan support that we got House Bill 1929 passed. And that, for the first time in this state, and we think the country, establishes Bridge Housing, a 90-day safe housing. It's all voluntary. It is recovery-based, although it's harm reduction in that medically assisted treatment is involved, and no one's going to be kicked out for one relapse, particularly if they want to get back on track. But I always want to be transparent that what we heard from young people, and Sarah will talk about this, she and the young people representing North Star had multiple focus groups. And what we heard loud and clear, including back to 2018, when we wrote the report, when I was at Away Home Washington, and my visits with the recovery school, what we have heard is young people want a place where they are supported to try out what it means to be substance free, to be healthy on their meds. There's lots of places they can go that they know they can use. No one's saying they'll never drink another beer or smoke another joint or whatever. No one's saying that. But what they are saying is, when we came out of inpatient, we wanted a safe place to try out what it meant to be substance free. And that's a big part of the bridge housing. So with that, Sarah, is there anything you want to say before we kick it off here?
No, not yet. I think I'll be saying quite a bit here in a little bit.
Okay. I will just say this before I turn it over to Lauren. We conducted our first training for the Friends of Youth staff, and we hope to do that in Spokane with the Excelsior Wellness staff soon. So, but yeah, please take as much time as you need, Lauren, to just give us an update on where you're at, why your organization decided to apply and submit a pretty lengthy proposal for this program, and anything else you want to add, please.
Yeah, thank you so much. We do have a brief PowerPoint today just for the ease of following along with the content of what we're talking about. But before I pull that up, Ryan or Stacey, do you want to speak to kind of Excelsior's kind of position about starting up the program? Do either one of you want to talk?
Yeah, I can just say a brief thing. Excelsior, this fits really well within our mission. Kind of a taproot for us is this transition age youth. A lot of us have had experiences working with youth where the only option was the best shelter for them. And so if we can be involved in transitions from higher levels of care to housing and connect people to their families or a supportive living environment, we definitely want to be aligned with that work and are deeply committed to that population. So we appreciate the opportunity to do this work and align with some of our existing programs, and looking forward to get started. So thank you.
Okay. I'm not as familiar with Zoom, so I'm going to try to share my screen.
And if you need help, you can send it to me and I'll share it for you.
Okay, let me give it a try here. That popping up?
Yep. You just need to
Okay.
make it a little bit bigger. There we go.
Oh, did that work? Okay, I don't know what I did. So as y'all know, this is, we're calling it the Bridge Program, 90-day transitional housing program, really trying to help reduce the risk of homelessness and empowering young people to chart their own path, whatever that means towards them. The picture on this slide is a mural that's on our gym, and I think that's something that is central to this program of also creating hope. So we've passed this one. Some of our key goals with launching this program is, again, to prevent homelessness, but also ensure that continuity of care, and again, and what that means to the young person. We have a lot of integrated services at Excelsior. We have a primary care clinic, and management, we have mental health groups, we have a wellness center with a care closet. We have a lot of different things that are available to the young person, and we really take their lead on what wellness looks like for them and what kind of things they need or want. Another goal is to strengthen transition pathways, linking from that inpatient setting to get back into the community with really structured care coordination and wrapping around them. And then empowering young people's voice. It's been awesome to partner with North Star and with the people here at this meeting to co-design this program and listen to the guidance and implement the guidance that is shared with us. And we continue and plan to do that for the longevity of this project in this program. So progress to date, kind of broke it into these areas. Facility preparedness, we've made it through our licensing renewals. We've done safety reviews on the building and some planning for readiness that includes furniture and flow of the building. And so that's kind of where we first have started. Then we move into our staff and infrastructure. We've hired a lot of key roles: program manager, care coordinator, behavioral health techs. And so really building out the team and making sure that that they are prepared for the program, having a lot of pre-launch alignment meetings with the staff in the program, as well as planning to have one with North Star, and then just inter-departments. It takes a lot of people to get the program going, so ITIS, billing, nutrition services, and so on. So that's been a lot of collaboration that's been occurring during this time. We also have the policy and procedure development and finalization. Again, that's the workflow. Those are the conversations that we have here and stuff that we've sent to HCA, I guess, about what we'll do around like eligibility and screening and intake, referrals, and just making sure that those are in place. Another big part is the data integration into our electronic health record, making sure that we're intentional about how we'll document services and how we'll capture the program outcomes and progress for individuals, so that way we can share the program's impact. And then just stakeholder engagement. Again, that's across departments. It's working with North Star and HCA, talking with Friends of Youth. And so that's been critical in our progress. And this is our forward strategy for the next couple of months. We're completing that staff onboarding and training. There's still some roles that we're hiring for, and we're going to be working with North Star again to bring them out here to come meet our staff and train them. We're also finalizing some of our materials, some of our intake packets, and kind of how we document and gather information has to be adjusted a little bit. Working with North Star and the coalition around like what does fully a daily schedule look like. We have kind of an idea, nothing super structured, but something that there's a predictability in the day of what it looks like to be in the program. And then in our record, really tailoring what care plans look like for the Bridge program, because they look a little bit different. And so having that return to community plan really implemented in there will be critical. We have some plans for communication. We do have a magazine that Excelsior puts out, I think twice a year, maybe 3 times a year. And so exploring right now how we can feature this to just increase visibility about what's going on over here with our partners, and working with our marketing and communications department to kind of plan those internal communications and external. And then we have that initial launch phase, really rolling out this program with the core services and staffing in place. And then always kind of forward thinking about capacity building. We know that some of the gaps are finding the long-term housing, even after a 90-day program. And so really thinking about how this ties into Excelsior's vision for more long-term permanent housing solutions for individuals. And so that's something that we keep on our radar in this with this program. I do want to open up the floor for questions. I want to double check that if there's anything Ryan or Stacy you want to add in, but if there's questions, I'm happy to answer.
Ryan or Stacy, anything you want to say? And then we'll open it up for questions.
Yeah, I just think one thing just about Excelsior, it sits on about 35 to 40 acre campus that we're working on kind of a long-term strategic plan to develop that. We got it rezoned. So there's opportunities to build right on the campus. This is down the road. And then we are going to break ground next month on a 24 unit apartment next to our vocational learning center that has 12 units dedicated to this population, not Bridge, but people exiting foster care, institutional care, and then with elders. So we're really trying to think about a continuum while we, as well as get the Bridge program off the ground.
Stacy, anything you want to add?
Well, actually, I had the same idea as Ryan, is just being able to really highlight in that continuum and thinking about not only they're all kind of popping up at once, which is an exciting opportunity as we think through this. So it won't be a long wait time as we go forward. But we've always known about the transition age housing that we want to develop along with some mentorship. We now have this opportunity for the bridge program, and we're very grateful about how this slots in and helps serve those who are exiting the system. And then thinking through other avenues to support our youth who are exiting the foster care system, that I think will also be a nice addition into that continuum of care. And I think being able to partner with North Star advocates in particular really will support us in being able to pivot and hear all of that, as you said, very rich research around what's effective, what do the youth want, being able to balance that with our own internal programs in terms of hearing the voice of the youth and ensuring that we're meeting the needs. So super exciting time for us.
Yeah, awesome. I have to say, I remember when I was first pitching this idea 2 or 3 years ago and talked to Representative Sen, who is now Secretary of Department of Children, Youth and Families. And her feedback was, sounds great, Jim, but can you actually get providers? We have a lot of money out there on the street. We can't get anybody to bid on this. And I just can't say enough about both these organizations that came to the forefront and put their bids in. And I'm just really, really excited and love that you had hope. That was a theme that came up at the Friends of Youth as well. And I also want to say the legislators will introduce you more formally at around the 2 o'clock hour, but feel free if you have a question now, or anybody, if you have a question, just come off mic and ask, and then we'll move to Friends of Youth. Lori Lipple, please. Good to see you. Board member and advocate extraordinaire in Washington State, board member of North Star Advocates.
Yes, definitely a board member. Thank you. Hi, everybody. Question. First of all, it's wonderful, and I had the great pleasure of being able to tour Excelsior 2 weeks ago. So good to see you again, Ryan. My question has to do, and I'll sound ignorant because I am, about coordinated entry. So before you are able to have your own housing on your great land there, and you're trying to find housing, will this population have to go through the coordinated entry door, or would there be some way to not have that have to happen? And I'm also thinking about all the housing that has been developed. I don't know Spokane well enough to know what direction, but over by where Rising Strong is, the old convent. So wherever that is, it's not downtown, it's away from downtown, and there's a whole bunch of housing that Catholic Charities has, I know, been involved with.
I think there'll be part of the youth will be appropriate for coordinated entry. I think the goal is to really establish, or one of the goals is to establish a lot of those informal relationships. A lot of the young people, I shouldn't call them youth, I guess at that age where I can do that, but the young people will hopefully get connected there. But as we know that the resources will be insufficient for housing, one on just the housing side, and then how do you pay for that? So there's going to be a lot of work in job training and using connections to try to get folks through the door. We will, for those folks that qualify for certain sort of foster care vouchers, we'll lean on those. But that's going to be a big body of work to try to get folks stable and supportive housing. So that's why we're trying to build it as much as we can ourselves. You kind of have to establish a resume of homelessness in order to qualify for those. And we're trying to be prevented. So, but more to come on how we're actually connecting folks. And we do have a pretty good pipeline in Spokane. Lauren's done a really good job of creating relationships with our Life Point program, but we do run into those pretty significant housing barriers.
Yeah, good question. Sarah.
Jim, you may have other things to say, and Lori, I appreciate that question. And I also want to say that part of what I'm excited about is that resource sharing and connecting young people with housing flexible funding, which Lori, I'm sure you're aware of. And we actually had building changes come last month and do a prevention diversion on HPDF, on YDIB, and then the contract does come with flexible funding specifically for this population for housing. So I personally, and I'm excited to see what the data looks like in terms of that flexible funding and how that helps the young people actually access long-term housing. So I just wanted to put that out there. And Jim, I'm sure you have something, and then I want to make sure we answer Melissa's question in the chat.
I'm gonna ask Melissa to come off. I'm gonna try and block that chat stuff.
I know
Come
you
on now,
are.
come to the table.
Well, I didn't want to interrupt if you had something more to say on the
Yeah.
last question.
Thank you. I never have a hard time getting in. We want to hear your voice, my friend.
Okay. Well, I'm curious to know what kind of support youth will have for mobile technology and Wi-Fi, because that is definitely an access and opportunity maker or breaker for youth, for the youth that you're talking about.
Yeah, they'll have Wi-Fi. The building has that. We also have phones in the building, and of course, if somebody doesn't have a phone and they need that, I think we'll be able to support that. We know how important it is for people to have connections and to be able to talk to others and use the internet for interactive game, whatever it may be. We know that's really important, so that's in place.
In the reentry, though, to community planning, is that part of that planning process?
I think it'd probably be part of the return to community plan, particularly if a young person elevates it. I think there'll be a lot of these kinds of issues. I want to protect the space that really the two primary functions of bridge housing is, one, to support and strengthen recovery as whatever that means to the resident. And secondly, to help them get to their next best place. And so when we were doing training at Friends of Youth, there were a couple things that came up, like, well, what if we want to manage their medications and our liability doesn't say you can just have your meds? Those are the kind of things that my recommendation as a youth worker, a staff, would be, that's why I want to help you get up and out of here and get to your next best place so you can run your life the way you want to run it, so that these programs don't feel like they have to be all things to all young people. They are a safe landing. They want to support that recovery, but mainly we want to be good with Sarah and all your support. Get good at, well, what vouchers or what resources is this young person eligible for? And let's get busy focused on that. So Jim might be there the whole 90 days. Sarah might be there 2 weeks. And part of that 2 weeks, the motivation might be, yeah, this is okay, but I'm 23 years old. I want up and out of here. I want my own apartment. Well, let's help you get that. But it's a great question. We want these questions because it helps us think about what else should be in that return to community plan. Yeah, the other thing I want to say is when we started the Bridge Coalition, one of the main things, and I remember Rep. Macri talking with her about this and others, the homeless community, particularly many of the providers who serve unaccompanied young adults, youth and young adults who experience homelessness, are not really that familiar with the behavioral health world. In fact, me having one leg in both and working inpatient for a period of time, there were times I thought the behavioral health world could have been a little more humble in talking to the unaccompanied homeless youth providers who don't have all the resources, don't always have all the training, but they're on the front lines with these young people. And so that's really one of the things I'm really proud about, how we've come together with the coalition of getting these two systems, particularly providers, talking to each other. So I hope that continues. Not your last chance, but any other questions for Excelsior, for Lauren or others?
I have a question, Jim,
Please.
and it's not specifically necessarily for Excelsior, but for more regarding the whole plan. I think I'll introduce myself. I'm Katie Joannis. I worked with Jim at the Office of Homeless Youth Advisory Committee a few years ago, and I shared my story a bit last time. I lost my son to overdose in 2021. And one of the things that I found glaringly missing from a lot of his transitions of care was this connection back to like education or work or something productive. So I absolutely love that we're like reconnecting kids to community, but in this 90-day period, are they going to have access to those kind of things? Like, do you have a diploma? Do you need to get into a GED program? Is there work opportunities that are kind of start being built in so that they can afford housing at some point, right? So that
Right.
they aren't just kind of like stuck in this like another transition period. I feel like that was something, that I always like really wanted treatment centers and, different places that where my son got care. Like it always seemed to be like glaringly missing. We always had to go back to like the recovery high school. And then when he was 19, he didn't want to go back to high school. And so nobody was really filling that gap. So that was my question
Yeah.
about
No,
the larger program.
great question. The voice of experience. Sarah's going to cover some of this with return to community. What I will say is so both programs will have some approach, but remember, Jim might be in the King County Friends of Youth program, but I really want to return to my home community in Yakima. So what the bridge housing staff will do and the return to community plan is get Jim, make sure he's connected when he gets back to Yakima. Right. So again, this house, all of these good ideas are things that there'll probably be some makeshift band-aids. But the real thing is, rather than getting Jim enrolled in a school or community college in King County for 30 days, if I'm going to actually go to Yakima, would be to make sure Jim's either enrolled or knows how to get enrolled in Yakima. So again, I just want to protect this space about these great questions, and these programs they are a bridge. They are a bridge from the inpatient back into that young person's community of choice. But I also open it up to Lauren if there's anything you want to say about your academic or employment, sort of how you're thinking about that at this point, and Friends of Youth can address it when we shift.
Yeah, I think when somebody comes to us, we're asking all these questions. We really lean into those 8 dimensions of wellness from SAMHSA, and that's intellectual, financial, I'm trying to list them all off in the top, physical, all these different dimensions of wellness that are critical for us to understand about the young person. That even includes culture and different needs. So we want to know that about them and what their goals are. And I would agree that a lot of it is about the future planning aspects of what does education look like? What does job training look like for you? Because that kind of education, even when they come to us, even if we don't fully get there with them, we want them to be supported long term. So it's definitely something that's in the discussion and something that's captured from the beginning. So that way we're making an individualized plan for them and that they are supported wherever they may, whatever path they take. So that's kind of our approach.
Well, let me say, if you didn't attend last bridge meeting, go to northstaradvocate.org and watch Katie's presentation. We talk a lot about lived experience, and we highly value that. Katie, I can never give you enough love and respect for what you're willing to do to share your story to make it better for the young people and families coming behind you. So I want to honor that and thank you. Any other questions or comments for Lauren before we move to Friends of Youth? Okay, who's going to present from Friends of Youth? We're lucky to have a couple of you here.
We don't have a presentation. I think at the last meeting, we did do a little overview of the program, and Mo was able to kind of present what the program looks like. What I would like to give Noelle the opportunity to see where we are today. Our program is accepting referrals, and I'll let Noelle just speak to where we are currently. Thank you, Sarah and Jim, for being on site last week and providing such excellent trainings. And I think you were going to speak a little bit to that, but Noelle, if you can kind of guide the conversation.
Absolutely, and thank you, Paula. Yeah, my name is Noeli Sinsun, she, her, aya pronouns. I'm the Director of Shelter Services and Bridgepoint here at Friends of Youth. This is the first time that I have the pleasure of being a part of this meeting, so just looking forward to getting to know everybody. And I love what I'm hearing from Lauren, right, of just the mindset, just everything that's going on. And it's just like, hey, us too, right? So yeah, just a little bit of an update on where we're at with our Bridgepoint program. Is we had the pleasure of having Jim and Sarah provide us just with some very transparent and raw training that our team was just thrilled and just talking about. We're still like, man, remember what Jim, just very, very raw information, right? Like sometimes trainings can be like, here we go again, we're going to talk about trauma informed, but just really relating it to the work and relating, to our personal experiences. I think we had some raw moments with people just sharing, what their why of why they do the work and why they continue to do the work. And so just thank you again, Jim and Sarah, for that training. It was amazing, and the team's already asking when can we have them back out here. As Hala mentioned, we did have a soft launch yesterday, and we're just thrilled and anxiously awaiting for our first referral and just opening our doors to start serving young adults. For now, we're just being proactive about just thinking about the little things that we might have forgotten about, or just, reaching out to community partners and letting them know, hey, we are here and we're here to offer these services, send them our way, because, we're at a disservice the longer we wait to get people in the doors. Similar to what Lauren was mentioning, we've been meeting with our internal departments and just really honing in on their areas of expertise to just get the best practices that we can and trauma-informed practices in place to just really simplify the process and procedures to ensure that we're just getting what we can ready on our end as far as like data collection, and just keeping in mind, what approach we want to have and what culture and what community we want to build. Because as we all know, right, the first interaction can be the game changer between someone who stays and engages and someone who chooses this ain't for me. So we just really, really want to be mindful of what approach are we taking and what's more important, right? Getting someone in the door and offering them a meal and a break, or getting that intake documentation done when, things can wait. We anticipate that we'll have some adjustments that will need to take place as we begin serving clients as well. So just really taking into consideration that, policies and procedures, yes, they are final versions, but they're also drafts, right? And we're going to have to adjust some things as we hear feedback and as we start getting those young adults through the door. That what are they telling us that they need, and what are some of those things that we really, really want to take into consideration and get their voice on. So yeah, just really excited, because I think we also have a really great team, which Sarah and Jim had the pleasure of meeting last week. They really have the mindset of just the client centered around where are the unaccompanied young adults at? Where do we want to be? Where do they want to be? And just being very clear that we are here to be of service, that we are a resource. Use us, right? Just dare to dream and challenge yourself of like what you would imagine a life that you would want, and how do we get you there. So just really, really emphasizing on what Lauren was saying, right? Taking into consideration where they're at with education, with employment, and just say, hey, why not you? Why not think, if you want to be a lawyer, let's get you there. If you want to be an educator, let's get you there. And just really, really focusing on meeting them where they're at and just working with them. And not, I think one of the things that came up during the training was a lot of the times they're being talked to about, this is what you have to do versus having the freedom of choice. And that's something that we really, really want to emphasize on. Is it's a choice. It's a choice to be here every day. It's a choice to show up every day. And most importantly, it's a choice of where you want to go, and what your tomorrow can look like. We're just here again to be a resource and to guide you and to get you there, but it's a choice of what you want to do. And really just excited about what we got going on, and looking forward to just having, young adults go through the door and just learn from them, and really get that feedback back of like, this is what we came up with, the idea of like what the house should look like, what the program should look like, what the structure to look like, and we're open to feedback of what is it that you guys need and what do you guys want. So we're really, really excited, and yeah, that's pretty much my quick snippet of where we're at.
Well, we really enjoyed the training, and you're right, we were so humbled by your staff, by your leadership, by the commitment and passion. The only thing I need to have you promise is this is not your last time coming to this meeting. We hope you're a regular presence. And so you spilled the beans that you're taking referrals. So of course now my phone's blowing up and the chat's blowing up. How do we how do we make a referral?
Yeah, so we have a two-step process, of course. We have a phone line that will be open to community partners if they want to phone in and just make a referral that way. We also have a general email that will be monitored 24/7 as well as the phone. So it could be a phone referral, it could be an email referral, and then we would have a case manager reach out and kind of just get that basic information as far as like, do the timelines meet, right? Is this someone that if they're looking for placement next week, do we have a bed or a bed that will be available? So there's a couple of different steps. And like I said, right, it's definitely not something that we're closed off to for alternatives. I mean, those are the two methods of communication that I think most people think about, but we're definitely exploring other areas of like, would it be easier to do, you know, like a quick application online or something that would be a little bit more easy and accessible in this generation and age, right? Everything is text message, everything is give me a QR code and I'll fill out the form. So we're definitely exploring other alternatives and getting together with our data and just our other departments to see, are we thinking, you know, further beyond just an email and a phone?
Yeah. I'll come to you right away, Sarah. I want to say that per the law, 1929, part of the eligibility is 18 to 24, up to 25, coming out of an inpatient behavioral health facility that can be substance use and or psychiatric. I wish we had more co-occurring, but we know most of the young people are facing a combination of that. Or they can be recently discharged from an inpatient facility within 30 days. And we talked a lot about this at the training. I want to give you a scenario. Jim might have been discharged 3 weeks ago, and I'm just going to talk straight up, might have been loaded as a dump truck every day. The program has the responsibility to interview Jim and say, wow, like, how are you going to get into this recovery mode, given that's what the milieu's about and the culture of the house is about? If Jim's been high and using every day for most of those 30 days, I might need to go back into inpatient and then come to the bridge. If Jim's been out for X period of days and has been relapsed a couple times, but has been going to meetings and really is presenting, no, I was doing that for survival. I want to be in recovery. That's a different scenario. And so we talked a lot about there could be some gray areas in this, and it's going to challenge staff. So what are those tensions? How do I have a safe environment? How do I protect the young people who are in there and white knuckling it every day versus bringing Jim in who might have something in his back pocket or his backpack? I have to belabor this. I told this when we wrote the report at A Way Home, there were two stories that continually stick out to me. One is a young woman, 23 years old, who talked about identifying as queer, being kicked out of her house at 14 or 15, not able to get into foster care. So basically surviving on her own, shelter hopping, couch surfing, picked up an addiction, picked up some anxiety and depression as a result of the survival and the trauma. And then at 22, 23, she went into treatment. And she's talked about, and again, this made me cry. In the middle of the treatment, she said, as I started to really clear out, I realized I have a chance to create my own life for the first time in my life. I'm legal. I'm of age. I can get a job. If they just give me a little bit of help, I can get started. I want out of this system. I don't want to be home. And then they sent me back to the emergency shelter where I could smell weed a block away. What the F is that about? So when we take some heat about, why are you keep talking about being substance free? That's why, for that young woman there. And young people have told us, I know where to get high. I know where to do the classic harm reduction. I want some place that I can try and do this for a while. So I really appreciate the providers. So the other criteria is that they're experiencing or facing unaccompanied homelessness. So please think of all that criteria when you send your referrals, because we don't want a bunch of referrals that young people are not eligible for any number of reasons. And then somehow there's this early narrative that they don't want to take young people. These two organizations have decades of history of taking hard young people who are in a hard place. But the law is the law, and we're protecting that. So any questions for Noelle? Thank you so much. Please hang around as long as you like, and then see if there's any questions. Any questions for Friends of Youth?
I just wanted to add, right now we did open one building, so it's five beds are open, and we are actively renovating and updating a second unit, a second building to be ADA accessible. And once that is open, we'll have 10 beds, and we'll do an actual, full on launch at that point. I do have flyers with all of the information as far as referrals and intake. I couldn't attach it here, so I can forward that on. So you have a lot more information about the program and the information on who to contact, what the eligibilities are with regards to our program. But we're really appreciative of North Star Advocates and the support from HCA and North Star on enabling us to open up this program and offer the services that we feel are crucial to really rounding the services that Friends of Youth provides. It's a need that we've had within our programs and our shelter setting. A lot of our clients did come from inpatient and come right directly to the shelter because they did not have a place to go. So this is just a way for us to round out our services, tap into our mental health and substance use division, really supporting. So it's a cross division program that really helps us serve our clients better, and hopefully the clients that will be coming in through this program. So thank you.
Yeah, I love it. That's the other thing we get to learn here, like Friends of Youth. What a great model. They have two houses side by side. So they'll have 5 in one house, 5 in the other. Whereas Excelsior, I think they're more looking at what we thought of was the 6 to 10 program with 6 to 10 beds. So the cool thing is we get to learn. We're going to learn from these two programs as well. And feel free to send that to Sarah, and she'll send it out. And then hopefully we'll put it on our website. Go ahead, Sarah.
I just want to alert everybody to the chat, because they actually put in the phone number and the email for right now. And not only will I send out each individual's, North Star Advocates is also creating a one page to help advertise both programs. So once Excelsior is ready to go, we will be sending that out as well and help do some of that outreach with inpatient providers, outpatient providers, and community partners as well. So expect a lot of information coming over the next couple weeks.
Well, and I'm admittedly, I say, a blessed old school fool, and I love what's happening around getting the word out. My guess is when we get a couple young people in this program and people realize it's open, the flow is going to be enormous, and that's why we want the data in place, because one of the things we're going to learn is. And again, I'll say this so they will remind us, but we're in a horrible budget situation in this state. And our job as advocates is to recommend what we learn that will be good for youth and children, youth and families. So I don't know if we need another 90-day program because we'll have a backlog of referrals, or if we need a long-term program because while most of the young people got somewhere within 90 days, young people like Jim needed 95 days, or there still was nowhere to go, or I wanted recovery walker-based housing, or so that's what we're going to learn. And people are saying, well, make your recommendation now. And Sarah and I are pretty firm that we want to learn what we learned from this. And again, we've only got 6 months before the next session, but we think we'll have some trends about how do we continue strengthen our behavioral health system so that it's developmentally and culturally responsive to youth and young adults, specifically including those young people facing unaccompanied homelessness. Any other questions or comments? Well, thank you to our providers. I am going to, and I think I blew it. MJ, I'm so sorry. MJ was supposed to introduce the providers. This is me being an agenda buster. MJ, anything you want to say about any of this so far, being one of our young leaders?
I think it's a really great start to, the rest of these children's lives. And I think, well, young people, and I think that, having the right, environment in place is going to be really helpful for them to move forward.
MJ helped advocate for Substitute House Bill 1929 and for the HPDF. So thank you very much, and I apologize publicly for messing that up. Anything else you want to say? Now I'm feeling badly because I know you have so much important stuff to say.
Well, and I want to jump in, and MJ, Sierra, anybody, Mayana, but we do have, and those who have come to the meeting have heard from our lived experts and young adult experts, but we will be providing an actual panel for both housing providers, not through the Bridge Coalition, it will be separate, but direct consultation from our lived experts who have been in these systems, have walked this path with us, and have really helped been the backbone for creating this program. So I just want to give everybody a big shout out and kudos. And I can't wait to help facilitate that direct training to the housing providers, because really you all and all of us are the reason this is here. And we're at this point where we're actually able to hear that one of the programs is open. So I just want to say thank you again.
Yes, thank you, Sarah. And we talked about pivoting in real time. So if you don't mind, we really want to present on the return to community plan, and we may have time to tee it up. But I also don't want to lose the legislators that we have in the room. And so I am going to pivot to just, but actually before I do that, this is real time. Sarah, please, you and MJ and any of the young people on the call, take a few minutes to talk about what just the big picture, what the return to community plan is, how we came about that. I can tell. Go ahead.
Why don't I just quickly do an overview of the first part of that training, because I have PowerPoints, or do you want me to just spitball this? Really?
No, go ahead. Let's take 10 minutes and we'll go to legislators at 2 p.m.
That sounds perfect. And and really I'll talk about the history, and we'll do actually the case management training, Jim, if that's okay, in maybe August or September, because the young person who did work with me to develop part of this training is unfortunately not here today. And so I really want to make sure I give them the space to present this.
Great.
So
please take it. Thank you.
Yeah, and MJ, I'll ask you to jump in at any point, but I'm going to go ahead and quickly just share. Can you all see my screen? And I know I need to make that bigger. All right. Everybody can see my screen here? Okay, perfect. So the return to community plan, you've heard us talk a lot about it. And let's just see. Okay, great. Here we go. So as I said, North Star Advocates, we have multiple different avenues for young people to be involved. And we have the Bridge Steering Committee, which MJ, Mayana, Sierra, V, who's not here, have been instrumental, as well as other young people. We also have the North Star Advisory Council, where we have almost 10 different young people who rotate in and out. So we have those two groups. Besides those two groups, what we've done, really, it's been almost 2 years now, when V and I were talking, we did 4 separate focus groups across the state with a total of 46 participants. And we've met with different YABs. We actually had a Zoom training with this group. So we had different people from different walks of life, but the largest majority, it was 80%, were individuals with lived experience. And we really wanted to get key insights from them on what they wanted in the housing, as well as the return to community plan. And so what we started to see was we asked questions about barriers. Jim's talked a lot about this, you've heard this, but the overwhelming kind of consensus was that getting into treatment was very hard. And that exactly what Jim said, once they got into treatment, they left, they didn't have anywhere where they actually could be substance and drug free. So they relapsed, even though they really wanted to maybe pursue recovery. Early exits, a lot of them had, been exited from the programs, maybe for things that should have actually been treated while in inpatient. So just a lot of dissatisfaction with the current system. There was a lot of stigma, access to the services, and lack of resources. So really creating cliffs and truthfully deaths in the inpatient program. So then we kind of talked about Again, this was more of the lack of resources. We asked what some of the biggest kind of trends would be if they had something that would be a successful return to community. And people said, you know, after treatment, I didn't have housing and I went back to an abusive situation. So they talked about the need for housing. They talked about the need for ongoing support. And this is really where we got into the terminology as well. They talked about how the terminology was important in the houses, but also when we're talking to young people. MJ, I don't know if you remember being in some of those groups, but we had some really good conversations about recovery focus feels less judgmental, more supportive for the housing and return to community plan. I'm trying to get through this in 10 minutes. We surveyed young people and asked for the bridge, what are their viewpoints on early exits from the program? What happens if a young person relapses? And over 60% of people said that they want people to have a second chance, right? It's not this really black and white setting like Jim talked about and what we've heard from Friends of Youth and Excelsior and our young experts, that we want people to be able to have a real individual approach and not just be kicked out, not be discharged. So a lot of input went into those aspects. Here was where we got the input from exactly what Katie said. Young people made it really clear that they need job support, that they want to see educational assistance, life skills and trainings, mental health support, resource navigation. You know, right here, having resource navigators would help us know where to get food for clothing and other necessities. And then the other big one was enrichment activities. So providing creative outlets and support could help us connect and stay engaged. And again, I want to remind you that some of these things, oh, MJ, go first because you've got your hand up.
Yeah, I was just kind of waiting for, you know, a good spot to get in. Yeah, I would say that, you know, with doing this kind of work, it's really important that these categories be tailored to the unique needs of that individual that we're working with and supporting along the way. So these kind of categories they're broad, but like for a specific reason, because we want to be able to touch on these things, but we also want to make it, you know, enough that the person that is going through all these things, one, they don't get too overwhelmed, but two, they get to choose. They have the ability to choose, this is the direction I want to go, this is the path I want to create, and it's very individualized in such of a way. So I think it's really, really good that we have these categories, and it's good that, you know, we are able as a group to kind of help these kids and these youth along the way into successful recovery.
Yeah, thanks, MJ, for that. And you really had so much to say along the way in your input. And I will show a brief viewpoint of the return to community plan after this. I also wanted to, again, peer community support. So access to peers, which MJ is a peer, life skills, employment, the individual plan, safety and well-being. So there were just trends. The trends were so overwhelming in each group and young person that we took all of that information and we built it into a fully individualized, customized plan. And I just want to share my screen so you can see just really the first page and a couple of the pages. We're not going to go over it, like I said, in full detail because I did have it planned to have somebody do this with me. But I do want to make sure that we can at least show you all what everybody's hard work actually came up with. So let me get in here. I apologize. You're going to see all of my, okay, are you able to see my screen? Great. So again, I want to thank MJ, Mayana, Sierra, V. So we took all that information, all that data, and then actually had to create a plan. And so it's a young adult guide to housing and life after inpatient care. We have the introduction of exactly what the plan is, and then we have the different areas. And it's very clear that this was co-created and co-designed by young people. And so we even in our groups talked about emojis, right? I'm a millennial, they're Gen Z. Like, do we like emojis? Do we not like emojis? The vote was emojis. So really, really intentional. And again, that terminology and the approach was such an important aspect that we learned along the whole way. And what are words, but also how are actions. So one of the biggest things, MJ, that you also pointed out, it's not about having all the answers, and it's not about doing this at once. So the main priority, again, Jim said, is housing stability, but we want people to have access to all of these other essential items that everybody made it so clear that they wanted. So you can kind of see how this is done. They get to pick the community. Here's the different boxes, and this will grow. The housing providers will update this. We'll all work together on what this looks like. What were some of the barriers? We want to collect some of that data and understand why do young people not have access to housing? And then really having it be directed by that young person. I do want to show the add-ons, and I also want to just give kudos to the peer support part. And this is an example of some of the case management and individualized plans that we're hoping the housing providers can do. So if somebody was to check, I want to do a peer support group, we have resource guides for the providers that show all the different types of opportunities and resources are out there. So people, it's not just AA, it's not just NA. There are hundreds of different peer support groups that young people can have access to. There's medication management, there's smart recovery, refuge recovery, LGBTQIA, mental health. There's even something called hearing voices recovery for more of the mental health. So just an idea of the different options that are available for young people that makes it individual. Again, we have the mental health and recovery. So that's medication. This is the substance use disorder medication management, Jim. We had a lot of training about that. Suboxone, methadone, naloxone, Narcan. So making sure that there's access to all the different kind of tools out there. So I'm going to go ahead and stop sharing because I am right on time, but I want to make sure MJ or any other young person, if you have anything else to add, and then answer any questions. But again, I'm so proud of this group, and a lot of work has gone into this thing. And a lot of young people have had their hands on it. MJ, you got anything?
Yeah, I just just thinking about all this stuff, it does seem like there's like a lot, but there's a lot that went into it, and I just think that, we can just, couple with each other for support when we have these meetings. So if there's anything that, is going on with Friends of Youth or Excelsior, then we can kind of talk and have those individualized groups to kind of provide that support. So yeah, it's the beginning, but it's also not the end, and it's a continual journey along the way. So yeah.
Yeah, and thanks for somebody left a kind comment, MJ, in the chat. And I do want to say again, part of that, and we'll probably bring this for the TA for the housing providers, but V did put together a full case management approach from a young person lived experience as well as a case manager. So there is a very in-depth training on this return to community plan that they will give to the housing providers. So we'll figure out a time where we can arrange that and make sure that they really get the space to do that, Jim, because they work many hours on the presentation. And Rachel, I see you. So thanks for coming, and yeah, of course, we'll get you a copy of everything. So with that, I'm going to go on mute. Hand it back to you, Jim, and love to hear from everybody.
Yeah, any thoughts or comments? Thank you, Sarah, to you and the young people. It's really an extraordinary piece of work and an innovative piece of work. I will also remind folks, not everything is going to be completed on this plan during their time at the Bridge Housing, but we wanted to reflect to young people, particularly the passion and the joy piece, that there's more to you than a treatment plan. Right? So it may be that Jim gets the housing piece and gets the mental health support and a couple other things, but then I take this plan with me back to my community and it continues to come alive, as MJ says, on my journey. Thoughts or comments on the return to community plan before we shift to legislators? I see some have just joined us. Please do add your name, pronoun, and organization in the chat, and anything else you want to add. If I owe you money, please don't add that. Okay, well, again, I can't say how appreciative. So you know, with Mockingbird and all of my career and Sarah's good work, people say, "Oh, you got that bill passed." I will say, Jim never passed a bill. Legislators pass bills. We advocate for it, but none of that goes anywhere without champions, and we have some here. I'm going to start with Rep. Macri because I know she's got to leave, but I also want to say Rep. Macri was our champion on the budget end. Getting the policy piece passed is one thing, getting the money to fund it is another. And I'll remind folks that 1929, to prove it's bipartisan, in fact, Rep. Eslick was #2 on the bill, Rep. Cortez was #1. It did not have one negative vote through the entire House, the floor vote, the Senate committees, the floor vote, all the way through. So I think that is a commitment both to the awareness that we have a crisis, but also the commitment to young people from our state legislature. So Rep. Macri, please.
Well, thank you. It's really been great to be here, and just many thanks to Friends of Youth, and congratulations on opening, and really looking forward to Excelsior's program as well. This is such incredible progress and is just a testament to the tenacity of everyone in this group. So really, it's wonderful. The fact that it's so informed by young people with lived experience, having been tossed around a fragmented system that has not been, well designed or person-centered, and the ability to just inform a much more compassionate, rational approach is great. So I just want to express my gratitude and say, obviously we have a lot more work to do to make sure that, well, first of all, young people don't find themselves in these situations in the first place, but when they do, that we really have a system that responds well to people's needs, and that we don't have to create all these models to work through a convoluted, fractured system. So I'm just grateful to all of you. I'm so grateful for my colleagues who are on this call, and of course, Representative Cortez, who's not able to be here, but has been a true champion also on this. And it's really helpful just to sit with you and listen, because it elicits all these thoughts that many of us in the legislature have been working on, including, Rep. Callan, of course, has been leading our children and youth behavioral health work group, and Rep. Eslick and Rep. Davis, of course, have been longtime participants in a lot of that work. So how do we make sure we're aligning all the efforts we're doing to move forward? The budget picture, as Jim, you said, is terrible, and it's like getting worse by the day. It will be challenging this next session for a number of reasons, including our own state budget dynamics and state economy dynamics. Of course, the cuts coming from the federal government, particularly in the healthcare space. And so that will present challenges, but I don't want us to not be engaging on this. We had an effort. We tried to expand the number of sites. Last session, we were not successful in doing that. We counted it as truly as a win that we were able to sustain what we were doing. We were really in a protect and defend mode this last session. But I don't want to lose sight of both the fact that we have more demand for this kind of setting and service, and that we know we're going to need to do more things, like everything on that list. Housing stability, an issue Jim and I worked closely on, I think, for the past couple of decades together, is something that is going to take our continued attention and focus, and it's going to be hard to do anything. It's going to be hard to protect and defend in this next budget. But I want to be able to continue to engage with you all about how do we make sure that we're creating pathways to success. So one of the things I always say is, like, government is so good at getting us to the 5-yard line and never into the end zone. That's as far as I go in terms of my sports knowledge. But
So we do these things that are well-intended, that are great, that do take us down the field, so to speak, that make progress, but don't really get people the things they actually need long-term. So we want to continue to work towards that. So I look forward to working with all of you. And again, just totally grateful for all of you. So thanks for having me.
Well, we're grateful you took the time to come, and I hope this is okay. People may not know, Rep. Macri has decades of service on the front lines with individuals facing homelessness herself. So she's not only part of the legislative choir, she is part of our workforce. So thank you very, very much for all you do. Representative Eslick, I'll call on you. Representative Eslick is also on the Children Youth Behavioral Health Work Group, and she is the co-chair of the subcommittee of that work group, the Youth and Young Adult Coalition, and is a strong supporter, helped us with HPDF last year, as well as with the bridge. And one thing I say before I turn it over, we were not able to expand, but as Rep. Macri said, we were able to protect it. And in the budget, it says ongoing for this funding. Now, that's not a magical cure, but it is a signal that you better be ready for fighting a bear if you're going to come after this funding. And every one of these legislators on the call here today supported that. So, Rep. Eslick, thank you so much for being here.
Thank you, Jim. I appreciate everything that Rep. Macri said, and I want to emphasize something that she brought up about protecting and defending. It's going to be imperative for these programs to document, to follow after they leave, to make sure that there's going to be reports that we can hand to our budget writers to make sure that we can show them how successful we are. And I truly believe these programs are going to be successful. I do think we are looking at extended stay. 90 days is tough, even if you're just going through sobriety and trying to recover in that lane. That's just still not enough. So we're going to have to be able to figure out an extended stay or a program that's going to be able to embrace. And, it's not always about the money. And so maybe it's a foster family that's not called foster, but willing to take in these adults that are now ready to move on with their life and help them through their careers. I've often thought about what a great thing to do would be to reach out to alumni of our community colleges and ask them to give back by opening their home to these folks that want to go on with their career. And simply, it seems to me in our world of database that we'd be able to find these people and be able to do that home sharing, which is another one of my advocates and something that I've been advocating for a long time. But to home share with these kids, what a great thing to do to embrace and help them along their journey. I will do whatever I can this session. Don't know what it is going to be, although we are just finishing up, and I hope Lauren Davis talks about her drafting of the pieces that she's put together for our Washington Thrive plan and for our youth. She and Michelle, our chairman for our YAC group, have done incredible work in this area, and so I'd like to turn it over to her. Thanks, Jim, for the time.
Is that legal, Jim? Do you want to jump in?
Please do. I don't argue with legislators, especially over group facilitation. So she was trying to help us move it forward. So please.
All right. Well, good afternoon, everybody. It's great to see all of you. Appreciate all the expertise and passion in the room, and great thanks to my colleagues, Reps Macri and Eslick. I'll just say two things ever so briefly. One is this conversation is reminding me of a tiny little bill that I had that I worked on with Jim and the Rep Eslick and the Youth and Young Adult Continuum of Care group in 2022. I'll put a link in the chat once I'm done yakking, but it was House Bill 1860. And it was relatively minor, but I think it's worth a relook to see where we are. But basically what the bill did is it required the healthcare authority to ensure that in every Medicaid contract healthcare authority oversees the contracts with the 5 Medicaid managed care organizations, that they're actually required to include housing care coordination for people discharging from inpatient as a required service, essentially. Now, that's been a requirement for jails for a long time, and the MCOs have totally flopped and whiffed on that requirement. So I don't necessarily have supreme confidence that they're knocking this out of the park, but I do think it's worth a conversation and trying to nudge our friends at the healthcare authority. What reporting do they have? Is this working? Another thing that required is some increased, what they're called the Performance Measures Coordinating Committee was supposed to come up with some metrics to really track housing and homelessness among persons with medical assistance recipients, Medicaid enrollees. And not all of the young people that we're talking about fit into that category, but many or most of them probably do. So worth taking a look at that. And if it's not adequate, trying to advocate with the healthcare authority to enforce the contract, which can include corrective action plans. It can include withholding payments. It's not supposed to be, the burden is not supposed to be entirely on the inpatient provider where the youth is discharging from or the youth themselves. We've really got to put the burden on the insurance carrier and make sure also that the MCOs know if they are supposed to be doing this care coordination, they need to know about the bridge program then. And so trying to make that connection, I think, might be a good idea. And then the other thing I'll mention is, and I know, Jim, we've got a meeting to be scheduled about this, but just someone mentioned coordinated entry earlier. And, I had an interesting conversation with one of my partners in Snohomish County, which is half of my district, who works in just what I guess I would refer to as sort of the traditional housing and homelessness system, which, coordinated entry is the gateway to that. But I was talking to them about they came to me with a problem, which is basically I have people in recovery, not necessarily young adults, but people who are, not doing well in, let's say, permanent supportive housing or these other entities. And I was like, well, what about recovery housing? And then I started babbling about, we have over 350 Oxford houses. We have 225 Washington Alliance for Quality Recovery Residents certified residences. So we have all these recovery residences. And this provider, which is a very, very large provider, was like, wait, what? And this system exists totally, completely separate from coordinated entry. Like you could never find it if you went through coordinated entry. And so it was really interesting that they had never heard of any of these things. And so just making sure that, obviously the bridge providers are incredibly savvy, but that coordinated entry is an option, but then there's all these other entry points, right, for folks, and recovery housing, not for everybody, certainly, but it is exceedingly affordable. I'll just mention two other things. The legislature, the vouchers got curtailed a little bit, but they're significant. It's like $double-digit million worth of rental vouchers for people in recovery, exiting jails, exiting inpatient, 3-6 months. That could work from maybe so somebody doesn't even have to go to Bridge, or leaving Bridge into that, that can get you into a Walker and Oxford. And it's quite effective for a lot of people. And the rent is so affordable, particularly with shared rooms, that people can even work part-time and still afford the rent in those kind of shared living environments until they're ready to, sort of move on to their own apartment or what have you. So I think that's all I've got for now, but appreciate the opportunity and extremely grateful for all of the work of everybody in this Zoom room.
Sarah?
Yeah, thank you so much for that, Rep. Davis. And I do want to say we did have Jason Bliss come on, and I did a whole Zoom recording with his training, and that does live on our website. So anybody that has questions, I'm also happy to send that training to anybody, as well as the houses. But I'm so excited about the work that you've done and that they're doing in all the recovery residencies, and really see that as a great touch point for the bridge housing as well. So I look forward to more meetings, and continuing to broadcast that service as well.
Great. I'm so glad. That's fantastic. Yeah, I mean, I think, and Jim and I have talked about this, I do think, though, we can continue to provide training the other way. How do we make sure that Oxford and Walker providers are culturally competent to young people who live in their houses? You can even be, in some cases, a 17-year-old in certain exceptional cases, but typically 18 and up. But you've got 18-year-olds living with 42-year-olds. And so can we continue to provide continuing ed for those providers to make sure that they're serving this population as best as possible? And, I'm sure they're open to certain creative things. Like right now, all the houses are just mixed age, but there are, gender specific houses, for example, or, women and kids houses, men's and kids houses, men only houses. Could we think about, young adult houses, ? It doesn't really exist at present, but there's nothing that would prohibit that.
Yeah, thank you so much, Rep. Davis, for your leadership. Rep. Callan, please.
Thank you so much. It's been so wonderful to hear this conversation and hear a little bit more in depth on the community plan. Every bit of this that has been talked about today, of course, needs to be sucked up and pulled right into the Washington Thriving Plan. And just so my background, I co-chair the Children and Youth Behavioral Health Work Group, and have been doing that for a few years now. And then as part of that work group, we passed legislation that directed the state to, through the work group, to develop a perinatal through age 25 behavioral health strategic plan and a roadmap so that we can really build out a stronger continuum of care, from prevention, promotion of well-being, all the way through any level of service and care, including, of course, behavioral health, SUD, and any aspect of that, and seriously mentally ill, the deeper psychosis and all of that work, and going through not just the treatment of it, but the other part, which is exactly where you land so strongly, is the ongoing wellness, right, and sustainability and well-being, and allowing that direction and that pathway to thrivability and the sustaining of that thrivability. So that's the other part of the continuum that often so much gets missed, right? So we stay focused in responding to crisis, and especially when you have to go through a pandemic and do all of that work, and you see the crisis demands elevate and escalate. There's just we spend a lot of our time and energy and our dollars feeding that crisis system, and the only way to get out of that is if we start to understand, how do we shift our dollars? How do we shift our attention? How do we move way more upstream in that work? And then how do we really support those vital conditions for each and every individual, each and every child, each and every youth and young adult in Washington State, so that they can, through their own vital conditions, I mean housing, I mean food, I mean life skills, I mean, all of those things, right? Education, whatever pathway that they want to move and go towards. And so the Washington Thriving is the name that we've provided it. I'm sure a lot of you have talked about it. I know that Rep. Davis and Rep. Eslick and have been big contributors through the youth and young adult group and the subgroup through the Children Youth Behavioral Health Group, the Bridge. Jim is right in the middle of all of that. You've all contributed, I'm sure, one way or another, whether it's been obvious or not, in terms of providing that input and that feedback into the plan. So that's supposed to come out this fall, and we'll be presenting the draft plan to the Children Youth Behavioral Health Work Group in mid-August for their review, and then for conversation and discussion and adoption in that September-October timeframe, with recommendations coming forward to the legislature for the next session in that November-December timeframe. So the basis of Washington Thriving is really taking its lessons from the work of how you all are basing the Bridge and your community plan. It's got to be based off of and built around those that are needing and using the service, their voice, your voice, so that everything about you, what you need, how you're describing it, what does help look like for me? What does help need to be, and how do I feel like I'm getting help? And defining a system and a continuum of care and a system of care that way. And that's exactly what is presenting itself today. And I would expect nothing less because of all of you that are here, right, that I see in my Hollywood squares here, and how you show up to the work and know what is so necessary and needed, and really appreciate that you're leading and providing that example that way. I mean, we can take the community plan and we can just plug and play it in as the perfect example within Washington Thriving of what we need to do to support. So I show up through this Washington Thriving aspect and making sure that we're doing the things like Rep. Macri talked about, right? That we're hopefully preventing people from having to go into this space to begin with. So we're working on that element, and then making sure that every part of the continuum is built out and met with the accountability of those who are the funders, the insurance providers, the Medicaid system, that, all those accountabilities, all of that type of stuff. But that we have providers. And thank you to Excelsior and to Friends of Youth and to the providers that are stepping up to do this work and making sure that you're doing that. And then we need the funding to support that. Of course, we need the facilities. That's another place where I play in the legislature to make sure that we've got that space. And then we need to connect the dots between how do we best leverage and get the biggest leverage and bang for our buck to receive and really drive home what we need, what each individual needs, right, to be successful and get to that thrivability state. So an example, in the capital budget this last year, I was able to work, and we've done this for a few years, trying to get this started with Rep. Davis's energy and passion to provide capital budget funding to help really drive a sustainability of funding towards the Oxford Homes Recovery Housing network, right? Since I've been involved in the capital budget, we've been elevating youth housing, young adult housing, whether it's sheltering, day sheltering, or trying to expand on what that might look like, so that we're trying to provide capital dollars that feed into that, because we need to create the housing, but we also have existing resources that you want to sustain and maintain, or you want to convert. I think Lori Lippold mentioned, there's some properties, Catholic Services, properties that create an opportunity for purchase or don't need as much transition, so that we can bring that in and make it easier for providers to have the right space and build the spaces or maintain and change the spaces to be accommodating to what the actual needs are for the individuals and what they look like. So we have a long way to go in the capital budget realm, but the capital budget is one of those spaces that is in the best shape out of all of our budgets in Washington State. So making sure that we can really connect and take advantage of what is more readily available and how we can leverage and take the next best step forward that we can in all of these demands and needs, right, is what we need to do. So if you have thoughts about how the capital budget, which is all about building, and supporting, sustaining, and maintaining existing resources for this work, including, the affordable housing, the Housing Trust Fund itself doesn't lend itself in its model very well for things like the bridge housing projects. And that's why we're doing this very specific work that is been brought by all of you and really shepherded by all of you to make sure, and then figuring out how does the capital budget play into making sure that we're continuing to fund and build that out besides the operating piece. And then clearly, the sustain and not lose on our operating funding. And then the other big factor, of course, is the workforce generally and broadly, and that includes our peers and all of that work. So we've got a big eye on that as well. And there is no idea, no concept, no thought that is too small in the space, because right now, especially with our budget constraints that we have, figuring out how we can support this work being done in community, and keep the work happening, and making sure that we're showing with I think, as Rep. Eslick said, with some data, that the state winds up saving a lot of money when we do this right. And we know that, we all know that, we feel it in our gut, but sometimes it's hard to show and tell that story, right? But we need to figure out ways to support our community and our providers and all of you in the space to really keep this step forward. And while it feels, and I have to remind myself of this every day, it feels very gloom and doom in terms of the context of so much of the politics and so much of our fiscal landscape and all of that. There is, again, no thought, no idea, and no step too small to try to make what we need to accomplish here happen. And I think there are pathways, there are steps, there are ways for us to make this happen and continue to keep progress moving forward, and to continue just to, even if nothing else, lift each one of you up in hope and filling your buckets so that you can sustain in the work, right? I mean, I think that is really key. There's nothing that any one of my colleagues here that have been here today are doing that hasn't been brought to us by all of you in your brains and your hearts and your passions, right? So it's all of us working together to make that happen. So I can't thank you enough for this work. I think each and every one of us, regardless of how tough it gets, is in for the long haul on the fight. Every one of us is dedicated to making sure that we make progress in this ways, and in particular, for our youth and our young adults in this space, where we have failed our transitioning age youth so miserably in so many ways in this state. We have a great opportunity and are spotlighting this work that you all are doing, and I think we can do it through the Washington Thriving work. And when you dive into that, you can go out to washingtonthriving.org. If you haven't engaged in that work or you don't know about it, if when the plan comes out, you don't see yourselves in there, you don't see the work that you're working on in that plan, please reach out to me so that we can show it in a way that you see yourselves in it. It can be reflected of the community. It's not a legislative document. It really needs to be the roadmap for where we need to be, and everybody can see themselves on where we need to go and what we need to do. It's not going to be perfect. We lost a lot of funding midstream, all of that work, but it brings me the hope for the future, and it's meant to be generational, and will take generational change, right, for us to continue to build it. It'll take a long time to get it all done and implemented, but thanks to you all, and especially with this work right here and the community plan, we're well on our way. So thank you for letting me go on and on and on, and thanks to
No,
all
it's
of you.
good stuff. We're at about 1 minute, so I just do want to. Now you know why as long as the drive can be there and back, I have so much confidence in our leadership in both sides of the aisle around youth and young adult being a bipartisan issue, and really thank you all for your ongoing leadership here. We are at time. I want to just say real quickly, we will not have a meeting in August as our regular plan. But we will get information out about Washington Thrive, and I think we'll look at September as being an opportunity to invite somebody in from the plan and really have people have a review of that. And I know we've covered it before. Yes, Sarah.
I just want to quickly say, Rep. Callan, thank you so much. And we did have somebody from Washington Thriving almost a year ago come in, and I have that recording as well. And I would love for us to re-engage now that we're farther in the process, but have been a big fan of the work that you've done and have included them in this process.
Excellent. Excellent.
Yeah. So we are at time. Thank you all for coming today. Thank you to our providers for your courage, sharing your expertise. You know, this old goat here is ready to cry, given the fact that we actually have the bridge housing open. It's been a long journey, and all of you have been part of it. So thank you, be blessed, and thank you to the young people for all your leadership and great support. Bye.
Thanks, everybody.